As you know, I have ALS, a neurological illness that has paralyzed me over the course of just 4 years. I have a truly amazing team of 7 skilled caregivers that help me live, work, and spend time with my family. But so many older and disabled people are not as lucky. President Biden has called for $400 billion to expand federal support for home and community-based care. Madam Speaker, will you also be a champion for the millions of Americans like me who need these vital services and pass this historic investment?
Absolutely. We're so proud of the president for making it an important priority in his agenda and in everything, in building back better. You know, it's not just a health issue or a caregiver issue. It's about building America back better. And we want to protect that initiative that the president has. There's some people who say, oh, $400 billion. No, that's what we need. And what we need it for is, for the reasons you described, to have the quality of life for people to be able to stay home and have caregivers. But it's also about how we respect those caregivers to make sure that they have the training, the recognition of the value of their work by paying them adequately, and also encourage other people to take up that cause. We almost every day have a session on this because it affects so many people. And the thing of it is that it will make America function. But what we want to do also, we want to recognize what they do. We want to pay them adequately. We want to make sure they have the training. We want to make sure families then are able to have people at home, which is so important. But we also want these workers to be able to unionize, and we've taken the lead on some of that in California on child care workers, but we want these people to be able to unionize, and so that it is highly clear, it's very clear that the pay, the wages, the benefits, the working conditions, and the rest are such that are worthy not only of the worker, but of the recipient of the care.
In 1993, you were one of 90 Congress members to sponsor a Medicare for All style, single-payer health care bill and advocated extensively for the legislation. You testified in favor of the bill in the House Rules Committee, like I did nearly 3 decades later, requesting a floor vote on the bill. You said that you supported the bill in part because of its, quote, savings.
Savings which spring from early intervention, people seeking and receiving health care earlier in the game so that they don't have more costly health care and hospital stays.
End quote. You went on to say that
it is interesting to see how under scrutiny, when people really take the look at these bills, how brilliantly the single-payer plan stands out.
And you conclude by saying that single-payer, quote,
it has support in my community, it has support across the country. Well, that's for sure.
I agree with every word of your testimony. Do you still support single-payer health insurance, Speaker Pelosi?
My comments far preceded the Affordable Care Act. I believe that the Affordable Care Act has better benefits than Medicare has, and I have made that clear. Strengthening Medicare was very much a part of the Affordable Care Act. We took funds from one place where the Republicans wanted to put them to extend the solvency of Medicare, because that is essential. It's a pillar of economic and health in our country. That we want to expand the benefits by having the Secretary negotiate for lower prices is very much a priority for us, has been over and over again. But since the 25 years or more almost of when we were fighting for that in the Congress, we didn't get it, and we don't have the votes to get it now. I know 153 sounds like a good number, but it ain't no 218. And again, we see it as, let's strengthen it as we did in the Affordable Care Act. Let's expand it by having the negotiated lower prices. Let's see how much money we have there to afford lowering it. But I am not a supporter of Medicare for All. However, it is very popular in my district. But I didn't want to be, I myself think the path to health care for all Americans is a path down the road of the Affordable Care Act.
Speaking of advocacy, a majority of the Democratic caucus in the House have co-sponsored the Medicare for All bill. In your testimony, you were requesting from the Rules Committee the opportunity for a floor vote on the bill, even though it had about 25 fewer co-sponsors then. If the sponsors of the bill want a floor vote in this Congress, when will you give them the opportunity that you were requesting back then?
I bring bills to the floor when they advance the cause of the legislation. We had many more members of Congress on the Democratic side then. So I cannot put my members on the spot where it is not helpful in their districts to do this if it's not what they actually believe. They believe the Affordable Care Act is the path to go. And I'm not going to bring a bill to the floor that has 156 votes. I'm just not going to do that. And that's interesting, but it's not, I always want to show how strong we are rather than how lacking we are in having the actual vote. You know, just so we're having this honest conversation. I don't want to put members to walk a plank on a vote that we ain't going to win.
I disagree with your assessment, but I am grateful for your openness and honesty. It's now been 11 years since the ACA was enacted, and many of the flaws, from exorbitant costs and power for insurance and pharmaceutical companies, that existed in the original bill you griped about are still in place today. Madam Speaker, the ACA was always supposed to be a starting place for universal health care, not an end point.
That's right. That's right.
How do you plan to fix the flaw in the bill that made you and your colleagues so angry in 2010?
Well, we did right then and there, Ady. I said to the president we would only pass that bill if I had the 51 signatures from senators that they would agree to the list of amendments that we would send back over to them. So President, I don't know if he said it in his book or not, the story is that we'll pass it as long when I get the 51 names on a piece of paper and this is the list of amendments, I can't even ask my members to vote for that bill unless it's amended. And they gave me the names. It was actually 50, and one person wrote his own letter because he wasn't in town to sign that. We got the 51, then the legislation became law. So no, I would never even have brought up the Senate bill, quite frankly, because our orientation is more toward poor people, primary care, but we all do share the view that health care for all Americans is our goal, and we want to hasten that goal. Now, what is the fastest way to do that with the best quality care that we can aspire to? We want to reduce the time between what is inevitable in our view and inconceivable to some others, so that we are putting behind us the idea that in some countries you have access to health care, but not in the United States. Quality, affordable health care for all Americans.
Thank you for your time and leadership, Speaker Pelosi. I know you have a lot of work ahead of you, so I won't keep you any longer, but please remember this conversation and the millions of Americans who are calling on you to guarantee health care as a human right in this, the wealthiest nation in human history. Medicare for all is possible, and you can be the hero that leads us to the mountaintop. Thank you.
You are the hero of heroes, Ady, and you just inspire us all so much. We all are full of love for you and your beautiful family, and your values, your persistence, your effectiveness just can never be exaggerated. You are indeed a hero. It's an honor to be with you. Thank you so much.
Talk soon. Thank you.